Hi there, thanks for joining me again. Today we're going to talk a little bit about how we can repair an inguinal hernia and what the current approaches are, coming to you from Sydney, Australia, and also looking at what you can expect with regards to recovery. The major approach of repair at the moment would be minimally invasive. We use a lot of laparoscopic surgery, which is the current standard, and more recently, and in line with what's happening in the United States, we have been applying the Da Vinci robot to repair the hernia. And so far we've had some excellent results. The premise of the repair is the same, using a mesh which distributes the stress of the hernia and allows prompt recovery and reduced chance of the hernia recurring. We find that the robot does allow patients to go home on the same day and is quite favoured. What can you expect after surgery? Usually we try and perform it as a day stay procedure. There'll be the appropriate swelling, which is related to the carbon dioxide when we insufflate or pump up the tummy, so we can look at the hernia sites and repair it. Pain is very well managed with analgesia. We would expect you to have a gradual return to activity and avoid any strenuous exercise in the first 2 or 3 weeks, by which time you'll see your doctor. You can expect some bruising and also some discomfort. And we can take the recovery as expected depending on the follow-up times. Thank you.